Hi, I'm David Shearman. Welcome to Rogers TV COVID-19 special programming, our weekly interview with Dr. Ian Arra, the Medical Officer of Health for Grey Bruce. Dr. Arra, welcome. Good to have you back again.
Good morning.
Now, Dr. Arra, the last week has been very different in many ways because there has been some good news. It appears that the one long-term care home that we had that was in outbreak is no longer in outbreak.
You're right, and there are a couple of other good news, positive results there around that same concept. The Maple View nursing home long-term care has been declared over last Friday with the last case recovering, and there have been no new cases for 14 days at the time, so that's great news. No hospitalization in these residents or staff, and by definition, no death. Bruce Lee Haven is another facility that have been tested completely. There are 2 cases there and have been positive for the past while, no other cases, and it will be declared over in 2 days, May 7th, if there are no new cases. Sepoy Manor is another facility that there was universal testing or testing of asymptomatic people, and there was 1 case that tested positive. Everything came back negative. And we tested the same case a couple times, and we retested the original sample. All of them came back negative, and that makes it a false positive result, and it was declared over as well. Parkview is the 4th facility. So far, there has been 1 case with no symptoms. Everybody else was tested. All staff came back negative. Sorry, all residents came back negative. All staff except 3, they are pending still the results. So it could be a false positive, and if we can prove that, that's great. If not, the good result is everybody who came back has been negative so far. And the really positive result in all of this, that we were able to test these facilities within 1 or 2 days. And we talk about Bruce Lee Haven, about 250 people were tested in 1 day. It was great collaboration between public health, the facility, primary care, and staff from the hospital. So that is, again, reassuring to the public and to the system that we have the capacity to test.
That sounds like one of the things that the government really does seem to want, and that is universal testing or community-based testing. And it sounds like we're doing a pretty good job here in Grey Bruce.
So it's, again, as intervention, it is useful to reduce the anxiety in the public about the lack of testing. We are able to test, we have the capacity. And the big city media outlets have driven the public to believe that testing everybody is a silver bullet, which is not. The science does not support universal testing. It would have not changed our management in any of these facilities, whether we tested everybody or tested only the symptomatic. As soon as there is 1 positive case, we will implement the measures required to deal with it. So doing the extra testing is more or less futile. There's no benefit in it, unless, like the situation is so, the public is asking for it and thinking that we don't have the capacity. So the intervention itself is to reduce anxiety and reassure the public, not really to change the management of the outbreak.
I have to say that the awareness and the ability of our healthcare system to deal with COVID-19 is quite remarkable. I happened to have to go to the ER this past weekend, and they really do screen you completely and fully. And they didn't order a COVID-19 test on me simply because I didn't present with those symptoms. But I was quite impressed both with the strictness of the routine, but also what was was very interesting is the use of PPE and the personal protective equipment and the strategies that they were using both to protect me and to protect staff. It was kind of funny because I was one of the nurses who I have known for years. I didn't recognize her because she was so heavily gowned and masked, and it was only until I didn't even recognize her voice because the respirator she was using was distorted her voice a bit. So she says, "Oh, it's just me. Oh, okay." So it was, they're certainly taking this very seriously and appropriately so.
And you see, Dave, the fact that everybody's taking it seriously and appropriately so, the numbers we're seeing are very encouraging. We have an average of 1 case a day, which is less acceleration of the outbreak than 4 or 5 weeks ago. The doubling times over 10 days, 10 days. The doubling time is the technical term, how long it would take for the number of cases to double, which is a metric of how fast the outbreak grows. So the efforts to flatten the curve have been very successful. And that's, like you said, everybody's taking is concerned and taking the appropriate measures, whether it's the public, healthcare providers, public health recommendations, the government, NGOs, everybody around the table is doing the right thing.
So in other words, our numbers, the COVID-19 statistics that you report on a daily basis are showing that we are flattening the curve and that progress is being made?
Certainly. When we have 1 case a day on average for the past 3-4 days, it was 1 case on average on daily. It was for example, 3 cases in 1 day, then 2 days without any cases. So the average is 1 case per day. That is a very excellent results. We have no hospitalization currently. There was only 1 hospitalization in the past 7 weeks. No death. And we have had so far 4 outbreaks. 2 of them are declared over. And the other 2, again, no hospitalization. So that is good news all around.
I guess that means that we can be quite pleased with the way people have responded on one hand and then have a positive view looking forward.
Certainly. And going forward, there are reopening plans. The ministry, the provinces are, the province officials and the public health officials are considering it. Locally, we have a drafted plan communicated to the county, and we're updating them on it to have a list of businesses that would be reopened. It is the better practice to be consistent with the province, because we don't want to open before other areas, like we mentioned before. It will turn our area to a magnet where people from neighboring health units and counties will come here for shopping or vacationing if we open before other areas. So that's a principle. To be consistent with the rest of the province is essential. The other principle to it is to open in stages. So let's say we release a sector of businesses, a subsector, and we evaluate after 2 to 4 weeks how many cases we have. And if everything stays stable, we can release more businesses, or we decide to extend the same stage and just observe longer. And if we have, on the other hand, increasing cases, we can roll back. So it is an adaptive process on stages and consistent with the province and other health units. So all these efforts are put together to go forward in a safe way. And above all, the most important part, that the concern that the public has and has had, that has been very useful to continue. So social distancing will continue, although we're releasing certain businesses, and people would keep the good practice of hand washing, or the recommendation of to use masks or face covering in public if the need be. It's not a replacement to social distancing. Rather, it is another measure augmenting social distancing when social distancing is not possibility. If somebody's in a grocery store and it's a bit crowded, or could be there is no ability to have the 2-meter distance, having a face covering or a mask in public could be useful in the coming weeks to come.
It sounds like that we're going to see things rolling out slowly, but also that this is going to be something that we're going to be months, maybe even years, in terms of our practices. Would that be a fair statement?
I would say, to be on the safe side, I would say weeks, possibly months. Like, there is no way for anybody to predict the future with that much accuracy. All modeling is accurate for the first period. Then the further you go in the future, the less accuracy you would have, and it will be a guess, educated guess. If you look at at the distance of a year, we would be anticipating a vaccine by that time. It takes a year to develop a vaccine. So that might, if we have an effective, safe vaccine, similar, for example, the measles vaccine, that will make the issue null. If we have a treatment that's effective, that also might help in mitigating the effect of this outbreak. But I agree with you, it will be weeks and could be months that we're dealing with this, and depending on the second wave when it happens, because the first wave was flattened, which by definition means the herd immunity was not established. So you have to slowly allow the process to take its course without overwhelming the healthcare system. But at the same time, there's no way to just create immunity without the vaccine itself.
Will there be a second wave?
Probably, if there is release of reopening that is too quick, or if the ability to sustain social distancing fails for whatever reason it is, we might see outbreaks. Could be sporadic, could be a big outbreak, depending on the scenario that would happen. So with these reopening stages, there are different models that science look at. It could be dynamic social distancing. That is to say, we have social distancing for a month or two, then we open the economy for a month or a few weeks, then we turn it again and again in a way it would sustain the economy and would not allow the outbreaks to occur in a higher number. I don't know if this is practical. I don't know if it's even healthy for the economy itself. I'm not an expert in economy. The public health makes the decision to trigger the bigger decision of releasing the restrictions, but those decisions are made by many people around the table, decision makers, local political leaders, provincial. Again, public health would be the source of igniting that decision to start. The cases are controlled, so we can start releasing, but the process, and it's more complex than just the MOH or the science saying just release.
I noticed that the Premier said that the command table will be making some important decisions about, well, he dropped a hint yesterday about the long weekend and gardens and cottages, and obviously there are things you can't say, but do we have reason to be optimistic looking forward in the next month or so?
I would say yes, we managed to flatten the curve. And again, everything we do in public health has transparency in it. So whatever I know, I would share with the public. Nothing that we do is secretive. There is, the next step is to release and in stages again and evaluate every 2 to 4 weeks. The visitors and cottagers in our area, historically, we have a large number, like similar to some other health unit. I would say there are 7 health units that have the same geography we have, and it's a touristic area. So the arrival of cottagers, if they decided to come, it's something that might change and shift our ability to manage outbreaks. Again, the messaging currently is still balanced to say everybody stay put, whether you're a resident of Grey Bruce or a resident of another area, please don't travel unless it is essential. If somebody happened to arrive here, there are certain recommendations, and I would invite people to come to our website to basically bring their food with them and realize this is not the vacation land that it used to be. Now, if any cottager or a resident needs to go to grocery store, it's going to be a trip of 3-4 hours. It's not just zoom in, zoom out like it used to be. So just to give people the heads up that if they arrive here, they need to abide and comply with the same regulations that we are all under and the recommendations.
Sure. That's very helpful to hear, Dr. Arra, because I know that with the Victoria Day weekend coming up, especially, people are very concerned about getting to the cottage. And I've heard anecdotally that people are showing up and going home again, unfortunately. And we had that case over in Simcoe, Muskoka, where quite a number of cottagers came up to their cottage, developed COVID, and went home, which doesn't make much sense to me, but okay. But I gather the medical officer of health said that they continued the contact tracing and continued the tracing in their home, or the follow-up, I'm sorry, in their home health unit. So that was a good thing to do.
Certainly, and there's at least one order that I'm aware of where the medical officer of health ordered cottagers not to come to their cottages. And for that health unit, there could be many factors that would make the order effective. For us, we do believe that strong recommendation for people to stay where they are as effective as an order. An order could be detrimental to the relationship between locals and visitors. And again, we need to see through this emergency. If after 6 months or 2 years, tourism is one of the main sources of income in our area, and income is the main determinant of health. So again, let's keep the balanced approach to say there is emergency here. We have recommendations for people to have social distancing. We're planning to release gradually. If somebody is somewhere else, please stay where you are. If somebody is in our area, please stay where you are. And if somebody arrived here, whether a resident or visitor, we need to comply with these recommendations that we have for the goodness of the community and the individuals involved themselves.
Well, thank you, Dr. Arra, for your update and on what has been happening here in Grey Bruce, and looking forward to more good news that we had this week when we meet again next week. Thank you, and thank you, friends, for being a part of this special COVID-19 programming presentation on Rogers TV.